Hi, my name is Sean O'Leary. I'm a pediatrician and pediatric infectious disease specialist and a professor at the University of Colorado School of Medicine and Children's Hospital Colorado. I'm also the chair of the Committee on Infectious Diseases for the American Academy of Pediatrics. Today, I'm going to briefly discuss my commentary why the American Academy of Pediatrics recommends initiating HPV vaccine at age 9. The American Academy of Pediatrics recommendation states that HPV vaccination series can begin between the ages of 9 and 12 years. This recommendation differs slightly from the Advisory Committee on Immunization Practices recommendation, which states that the vaccine can be initiated at age 11 or 12, stating the series can be started as early as age 9. The commentary goes into the reasons behind why the AAP differs from the ACIP. Those reasons include the recognition that the vaccination uptake of HPV is really suboptimal. We wanted to think about what strategies can we use to increase uptake of HPV vaccine. One of the things that we were hearing as we were discussing this recommendation was that some providers had decided to make the switch to introducing the series at age 9 or 10, and we're finding that the uptake seemed to be increasing. We also were aware of observational data suggesting that this was true as well, that in health systems where the vaccine series was initiated at 9 or 10, completion rates seem to be better than in places where they were initiating 11 or 12. The other reason that we considered making the change in the recommendation was that offering the vaccination earlier offers providers flexibility in introducing the vaccine. For example, they could introduce it at 9 or 10 for some children or 11 or 12 for others. The other point that we recognized was that at ages 11 or 12, there are often 3 and sometimes even 4 or potentially 5 vaccines that children are due for. And what we knew was that if the vaccine is delayed, it's almost always the HPV vaccine. And so offering the vaccine earlier allows young adolescents at 11 or 12 to have fewer vaccines if they've already started and potentially completed the series by the time they're due for the other adolescent vaccines. The other big reason that we were considering making this switch is that earlier initiation may allow providers to avoid potentially uncomfortable conversations that they sometimes find themselves having with introducing HPV at 11 or 12. What we were hearing from a lot of providers was that oftentimes when introducing it at 11 or 12 or even later, the vaccine was inextricably tied to a discussion of sexual activity. Whereas when providers introduced it earlier at 9 or 10, they were finding that they weren't often having those discussions as much as when they were introducing it at older ages. So that meant that trying this recommendation at an earlier age may lead to actually more efficient conversations as well. The other thing that really played a big role in our decision-making was knowing that the immune response is very high for this vaccine at the ages of 9 and 10. Now, it's also very high at 11 or 12, but there were some evidence, in fact, that it might be even higher at the younger ages. I think this is a very promising strategy going forward. I'm encouraged by the early data that we're seeing at this point, and thank you for your time.